today's talk is with Dr. James Turner regarding exercise and immunity in the wake of the continuing COVID-19 crisis and the fact that we are all incarcerated in our homes. Exercise is going to play an ever important part of our general well-being. So it is with great pleasure that I welcome Dr. James Turner from the University of Bath. James, welcome.
Thanks for inviting me, Andreas.
So maybe, James, we can start by just expanding a little bit more on what you do at the Bath University and what your role there is.
Yeah, of course. I became employed by the university in 2013, and I'm a senior lecturer in physiology. So one of my main responsibilities is to convince all of our new undergraduate students that physiology is fascinating and make them enthusiastic about the topic. But of course, I also have a research group, and I undertake research projects that are related to exercise and the immune system in health and disease.
Yes, and when I looked you up on the Bath University portal, I came across the Centre of Therapeutic Innovation. That sort of struck a chord with me. Can you talk about that in a bit more detail?
Yeah, that's right. So the university has various structures. I'm in the Department for Health, but we also have research centres, and I'm part of the Centre for Therapeutic Innovation, and that brings together members of staff from across the university who undertake research that's related to disease or therapy, and as the name suggests, therapeutic innovation, because some of my research is related to how exercise can be helpful in cancer therapy.
Right. Okay. Well, that's very interesting indeed. I mean, maybe we start with a sort of general related question there, and that is, how important is exercise to our general well-being?
Yeah, so we know that people who are very active in the population are less likely to be diagnosed with conditions such as anxiety, stress, and depression. We also know that for patients who've been diagnosed with those conditions, that exercise is a form of therapy and can help to limit those symptoms. So overall, being active, so physically active in your activities of daily living, or undertaking structured bouts of exercise is good for your general well-being and your emotional well-being.
And more specifically then, what do we know about how exercise affects the immune system?
Well, some of the very early studies were published in the late 1800s or early 1900s. These were very simple studies in human volunteers. They usually involved collecting a blood sample at rest and then immediately after a bout of exercise. Sometimes this was people taking part in marathon type exercises, or sometimes just as simple as running up and down the stairs in a hospital.
Right.
And the findings were that if you compare and count the number of immune cells in the blood at rest to when you've taken a blood sample immediately after a bout of exercise, then the numbers of most cells increases substantially, doubling, tripling, even quadrupling. So those early findings suggested that exercise was some sort of powerful stimulus, or at least the immune system was responding to exercise. But it wasn't really known at the time whether that was an inflammatory response,
Right.
similar to what you see with some diseases, or if it was something else.
Right. And so this would be a heightened level of immune system within the body. What about other people who seem to suggest that actually exercise can suppress the immune system?
Yeah, so that idea came about in the 1980s. And that was when marathon running had become much more popular. And there were lots of studies that surveyed people who took part in marathons. And the summary of those studies is that when people were asked how they felt in the days after a marathon, around 1/3 of competitors said that they felt unwell. And that is having symptoms of an upper respiratory tract infection, like a common cold, sore throat, or a cough. But it was only around 1/3 of the competitors. And when those studies were followed up with more precise methodology, so
Right.
rather than using a self-report questionnaire, some sort of swab was used, like a nasal swab or a throat swab, to confirm whether the people who said they felt unwell really were infected with something. Then only around 1/3 of those people had a real infection. So there is some evidence, at least, that if you take part in a marathon, some people say they feel unwell, and an even smaller proportion of people have contracted some sort of infection. But what's become clear now in the current thinking, and this is aligned with the government recommendations on social distancing, is that those infections have come about because of the exposure to a large crowd of people, or
Right.
potentially touching contaminated surfaces like a handrail, for example.
Okay, I mean well, yes, I mean that sounds interesting. I mean, obviously, marathon running is quite an extreme sport, isn't it, James? I mean, and that may have a different impact on the immune system than regular, sort of more sedate exercises like physiotherapy, for example. Are there any studies that sort of distinguish between the types of exercise you do?
Absolutely. So there's lots of human studies that have been conducted in a controlled laboratory environment, and the effects of different types of exercise have been examined. Generally, the more prolonged and more vigorous the bout of exercise, the greater the change that you see in the immune measurements that you make. So very light intensity physical activities that you might do around the house on a daily basis,
Yeah.
they do cause some small changes to aspects of immune function. But if the exercise is much more prolonged, such as an hour of vigorous running, the effects are even larger.
And to heighten the immune system, is that the conclusion that is being reached?
Well, the general recommendations that have been made by the government or key organizations such as the World Health Organization are that people should try and accumulate around 150 minutes of physical activity each week,
Right.
and that's moderate intensity physical activities, and this is on top of your normal activities of daily living. Or it may be around 75 minutes of vigorous intensity physical activities. So the moderate intensity activities could be walking or jogging or light cycling. Vigorous activities would be running or cycling at a much faster pace, for example. Um, we know that one bout of very vigorous exercise will increase the number of immune cells in the bloodstream.
Mhm.
Um, this bout of exercise will also increase or improve the capacity of some of those cells to function. And that might be producing the chemicals that they produce as part of an immune response, or even killing cells that have become infected with viruses. Some of the early research, though, took these measurements before a bout of exercise, immediately afterwards, and around an hour later. And what you see around an hour later is that the number of immune cells is lower than normal.
Right.
And so many people thought that that was immunosuppression. But actually, more recent research has shown that it's not immunosuppression, but when those cells are lower than normal in the bloodstream, it's because those cells have left the blood and gone out to other bodily tissues where they're looking for infections.
Okay, well, that's very interesting. So just to return to the types of exercise, James, if somebody had, well, obviously we're not going to the gym at the moment, but let's say somebody had a home gym and would be doing some cardiovascular activity on a rower or on a cross trainer for a period of time versus doing some sort of floor exercises and physiotherapy. What is the difference between those two exercises in terms of immunity?
Well, so I guess if people are undertaking bouts of aerobic exercise, they might divide that up into, for example, 30 minutes on 5 days of the week. So it could be 30 minutes of walking on a treadmill or rowing on a rowing ergometer or a cycle ergometer. If you were also aiming to meet some of those recommendations from the government about resistance exercise or strengthening exercise or balance type exercise, then you might be trying to do that on a couple of days of the week. When we look at how those different types of exercise affect the immune system, it's the aerobic exercise that really raises your heart rate, it raises your breathing rate, that have a greater effect on the immune system than the strengthening type, balance type exercise.
Okay. Well, I mean, you've already talked a lot about the different types of articles and research that has been done. I mean, is it possible to sort of summarize the latest thinking on all of this in terms of the immune system?
Yeah, so we've published a couple of articles over the last couple of years, trying to change the way people think about how exercise affects the immune system. As I mentioned, we know that these bouts of exercise can change the number of immune cells in the bloodstream transiently. The numbers of these cells increases and they decrease. And as I mentioned earlier, when the cells decrease in the bloodstream, we know that they're going off to do their job. So we know that bouts of exercise just help the immune system to function normally. It's all part of this process of immune surveillance. We know that people who are very active report fewer infections. We know that people who are very active have fewer complications following surgery, or, for example, have shorter stays in hospital or need lower doses of antibiotics, for example. Typically, when we're looking at research that's examined hospital-acquired infections, for example, we know that people who are regularly active respond better to vaccines. So overall, being physically active helps your immune system to function well.
Yes. So, I mean, I think your clear message is keep active, especially at the current time. I mean, what recommendation would you give to people who are concerned about exercising at this point? Because obviously, either they may be concerned in terms of what impact it may have, but alternatively, they may not have access to a lot of exercise equipment to do a lot of exercise.
Yeah, of course. I think we have to pay attention to the government guidelines on social distancing, the recommendations that people should go out and exercise just once a day if you're going to leave the house. If you are able to stay away from people, then it's fine to leave the house and go out for a brisk walk. But if you feel uncomfortable about leaving the house, if you have been identified as being someone who is particularly vulnerable, then you should probably stay in your house. Perhaps you have a back garden and some outdoor space, and there's lots of exercises that you could do in that sort of setting, such as walking. You could do star jumps and those kind of exercises on the spot, for example. Even if you don't have an outdoor space, there's lots of exercises you could do inside your house. All those kind of exercises to try and raise your heart rate and raise your breathing rate as well.
Okay, and obviously a lot of people are now sort of reverting to technology to communicate at times like this. But what about sort of exercise programs? You know, I even see that the Green Goddess has made a reappearance from the 1980s on TV. I mean, is there things that people can do just basically in their living room to actually keep fit?
Yeah, there's some fantastic apps that could be downloaded onto a smartphone. There's even channels on YouTube where you could do exercises in front of the TV. So, as you say, the return of the Green Goddess, even the likes of Mr. Motivator. Into more modern times, you've got Joe Wicks, who's doing these PE lessons for kids at 9 o'clock in the morning on weekdays. All those kind of activities could all be done standing on the spot. It's your classical aerobic type exercises: star jumps, sit-ups, press-ups, lunges, burpees, knee raises. All those kind of things are certainly beneficial.
Okay. So, I mean, obviously, would you be able to summarize where the research on exercise and immunity is currently heading, and what we're likely to sort of see coming out in the future?
Yeah, so in one of the recent articles that we've published, it was a debate article published in the journal The Exercise Immunology Review, and it was a coming together of experts from around the world who have been publishing papers on exercise and immunity for a long time. And what we've identified is that there are some circumstances where, perhaps because of a profession, people are undertaking very, very arduous, strenuous bouts of exercise. That could be people in the military. And so there probably is benefit to understanding how extreme forms of exercise can affect the immune system. That includes ultra marathons, which are longer than a marathon. It would be very important to determine whether the small number of people who do become infected following a marathon are getting those infections because of exposure to crowds of people, or if there are some subtle effects on the immune system, although our research suggests that that's unlikely. I think a much more important angle of research is understanding how exercise can reduce the risk of developing certain diseases. We know that being active reduces the risk of developing cardiovascular disease, type 2 diabetes, and many forms of cancer. And another area of research is understanding how bouts of exercise or being physically active can benefit patients who've been diagnosed with those diseases too.
Right. Okay. No, that's very interesting indeed. How do you think society is progressing with exercise? I'm just thinking to all these sort of fitness trackers that everybody's wearing, including myself. And my brother, who lives in Amsterdam and is also self-isolating at home, is walking around his kitchen table several times to get his steps up. So I just wonder what you think the benefit of these fitness trackers has been so far, and is that something that people will benefit from?
Absolutely. So I think that these commercially available fitness trackers have some great utility. They can even motivate people to be more active. You can link up with people and compare the number of steps that you're doing each day. And it can be a really useful way to assess whether you're becoming more active over time, making some measurements or looking at the values at one point in time, changing your lifestyle and looking at the values again. I think it's worth emphasizing that we use research grade devices to assess behavior objectively. These are often more accurate than those commercially available devices, but I think that counting steps with these devices is a really useful way to assess how active you are.
Yes, no, absolutely. And obviously, it seems easier to measure the physical effects of exercise. How do you measure the sort of mental well-being, with the use of things like fitness trackers, etc.?
I think that's very complicated to assess. In a clinical setting or in a research setting, we'd often use validated questionnaires to assess how somebody is feeling. Um, or it could be a conversation with somebody who has training in mental health counselling, for example. Um, I'm not aware of a way that we could assess how we feel emotionally using fitness trackers unless they have some sort of rating scale on them about how happy you're feeling and so on.
Right. And what about sort of clinically? I mean, is it possible to measure sort of release of chemicals such as dopamine and serotonin in the body? I mean, is that would be an indicator in terms of a sense of mental well-being?
Absolutely, it can be done clinically or in a research setting. And as I mentioned, one of the key areas for research is understanding how exercise benefits patients with particular diseases.
Yeah.
One area of research is understanding how exercise affects patients who are being treated for cancer. We know that some cancer therapies, such as chemotherapy, can cause substantial fatigue. And it's now known that fatigue and also some of the side effects of the disease and the treatment, such as depression, are caused by inflammation. And we know that regular exercise is very anti-inflammatory. So making measurements in blood samples that are related to inflammation, or making measurements where you can assess things like you mentioned, such as serotonin or other endorphins, could be helpful in trying to understand those processes in a research setting. But of course, we probably can't do that in our own homes.
No. Well, that's been very, very helpful, James. I think we've had a good tour de force around immunity and exercise, and I'm sure our audience will really appreciate the guidance you've given. So thank you very much indeed, and I wish you all the very best. And I'm now just going to close it for our audience. And that is to say, I hope you all enjoyed this particular episode of BRLSI Spotlights. If you would like to find out more about similar content and spotlights and lectures online, please visit www.brlsi.org, where you will find an increasing number of items such as this. And Dr. James Turner has done a fantastic job today to help us understand the impact that exercise has on the immune system. Thank you very much indeed.